washing my hands. Okay. Hi, Rachel. My name's Laura. I'm going to be your physical therapist today. I see we have orders to take you down to physical therapy for your right total knee replacement. Is that correct?
Yes.
Okay, so for today we're going to do a little bit of strength and joint motion testing, a little bit of sensation, and then we're going to transfer you over here to this wheelchair and take you down to PT. Is that okay with you?
Yeah.
Can you repeat back a little bit of what we're doing today?
We're gonna go down to physical therapy. I'm gonna have some tests done one here on my joint motion and that sort of thing, and then go down to physical therapy.
Exactly. So do I have your consent to continue?
You do.
Okay, so first things first is we're going to take a little bit of your vitals, some blood pressure and your pulse. No one's ever told you that you can't take your blood pressure on your right side?
No.
You haven't had any surgeries or anything?
Nope.
Alrighty then. Alright, it looked like it was 118 over 72. Is that a little bit normal for you, or?
Yeah, it's a little high, but.
Alright. It might be a little from the medications and from your pain. So that's completely normal. We're going to go ahead and take your pulse. Alrighty. Alright, so do you have anyone helping you when you get out of the hospital?
Yeah, my parents live in town, so.
Oh,
I'm
perfect.
staying with them.
That'll be great. Is there any stairs where you're going to be staying?
No, actually, they live in the ranch.
Oh, great. Wonderful. Alright, so it looks like your pulse is 72. Is that normal for you?
Yeah.
Okay, perfect. Okay, so first thing, I'm going to look at your joint motion here on your left leg. And it looks like they gave you a pillow. So I'm going to go ahead and take that out for you.
Okay.
We don't want your legs to get stuck in that position. We want to give them a little bit more extension for you. Alright, so I'm going to go ahead and lift this leg a little bit. Okay. And we're going to go ahead and lift this leg up. How's that feel?
Feels good.
In, out, down. Okay. Relax your foot. I'm going to do your great toe. Sorry, I'm a little too close. That's fine. I am too. Alright, so we're going to go ahead and look at this right leg. I'm not going to bend your knee at all. I'm going to go ahead and wrap you around. I'll lift this leg. There you go. Alright. So I'm going to go ahead. Up, down, and is that okay for you?
Yeah, it feels alright.
Alright. How's your pain right now on a scale of 0 to 10? 0 being no pain and 10 being the worst.
I'd say it's about like a 4 or 5.
4 or 5? That's not bad. Coming right out of surgery. Hopefully we can lessen that pain for you. Okay, so now we're going to take a little bit of Goni measurements to see your flexion and extension on this right knee. There you go. Can you go ahead and bend this knee up for me as far as you can to where it's not intolerable. All right, that's looking good. Line it up. You're at about 34 of flexion. Now I'm going to go ahead and bend it a little bit to take you just a little further. Okay, sorry, I'm going to do it fast. That took you to about 37 degrees of flexion. Okay, so now we're going to go ahead and have you push your knee down into the mat here as far as you can.
I think that's as far as I can.
That's looking pretty good. Okay, I have about 18, so you're lacking 18 degrees from neutral of extension. I'm going to go ahead and push you down. Is that all right?
Yeah, that's probably it.
Okay. I got you to about 14. So you're lacking 14 degrees from neutral. So that's really great. So next thing we're going to do is I'm going to look at your sensory. I'm going to swipe this cotton ball on your legs, kind of like this.
Okay.
Okay? So every time I swipe it, I want you to tell me yes every time you feel it on your right leg first.
On this one?
Or your left leg, yes.
Just wanted to be sure.
Thank you very much. Go ahead and have your eyes closed. All right, are you ready?
Mm-hmm. Yes. 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 Ooh, sorry, I'm speaking English, but I felt that. Yes.
Perfect. Now I'm going to go ahead and do it on your right leg.
Okay.
So same directions as before. I'm just going to swipe you. Keep your eyes closed and tell me when you feel it.
Yes. 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 Yes.
You're hungry, I can see.
Yeah, I haven't had much to eat after my surgery. Yes. Yes.
Perfect. All right, so now I'm going to see, I'm going to swipe you on this side and I want you to tell me if it's the same, if this feels the same as that.
Okay.
All right, so does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
Does this feel the same as this?
Yes. Sorry.
Does this feel the same as that?
Yes.
Does that feel the same as that?
This one felt lighter.
All right. How about that and that?
I just felt it on this side.
Okay. This and this.
That one felt a little heavier.
And then lastly, this and this.
They felt pretty much the same, but this one a little lighter.
Okay, perfect. So now, I'm just going to put my cotton ball right here. I'm going to go ahead and do some joint motion testing on you. So I'm going to go ahead, loosen up that, relax that foot. I'm going to go up, down, in, or out. And as soon as the motion's done, I want you to tell me if it's which position your foot is in. And then we're going to go ahead and have our eyes closed for this test again. All right, you ready?
Yes.
Okay.
Up. In. Out. Down. Up.
Perfect. Now we're going to go ahead and do the same thing on your right leg, or your right foot. Have your eyes closed again. And this is up, down, in, and out.
Okay.
Okay.
Up. In. Out. In. Down. Up. Sorry, I'm tired. Out. I mean down, sorry.
Perfect. That looked very good. Now I'm going to go ahead, and I want your eyes closed again for this one. And
Sorry.
sorry, I'll try and grasp you a little firmer. As soon as I start the motion on this foot, we're going to do the same ones, up, down, in, and out. I would like you to mimic it on your right foot for me.
Okay, so what
As
you're
soon
doing
as
with
the
the
motion.
left, you want me to do with my right foot?
Exactly.
Okay.
All right, you ready?
Yes.
Eyes closed. Perfect. That looked excellent. Okay, so now we're going to go ahead and put your shoes on for you, and then we're going to try and get you up to sitting, and we'll do a little bit of upper extremity muscle testing, do some lower extremity muscle testing, and then it looks like we'll get you into the wheelchair and you'll go down to physical therapy.
Alright.
We'll be all done. Sorry. Shoe is a little difficult. Alrighty. How's that right leg feeling?
Feels good.
Okay, so what I'm going to have you do is I want you to lift up on your elbows, and then I want you to kind of crawl to your left while I move your legs to the right.
Alright.
I'll try to keep this leg straight, and then once we get up to sitting, this foot needs to be touch weight bearing, so you can put it on the ground, but I don't want you to put any weight on it.
Alright.
Alright, you ready?
Yes.
Perfect. Okay. Go ahead and come up. How's that foot?
It's good.
Okay. Is your pain any worse sitting up now?
No.
Okay,
Still
that's
about
good.
4 or 5.
Good. Okay, let's go ahead and get this robe on you. Sorry. Are you feeling dizzy or anything?
No, I feel pretty good right now.
Okay, wonderful. Go ahead and under you. Looks good. Alrighty. Now we're going to go ahead and take the sheet off. Make sure your gown is down. Save you for exposing yourself. Alright. So now we're going to go ahead and do some upper extremity muscle testing. So what I want you to do is put your arm out like this. I'm going to stabilize your shoulder, and I'm going to push down, and I don't want you to let me push you down, okay? Okay, 1, 2, 3. Great job. That's a 5 out of 5. Now bring your elbow back. Wonderful. 5. Now I'm going to go ahead and have you put your elbow out. Yes. 5. Then back down. Have your, there you go. Okay. There you go. Go ahead. Don't let me push you in. Get both 5 out of 5. Don't let me push you out. Perfect. Now I'm going to go ahead and have you have your elbow out like that. Don't let me push you down. It's a 5. Arm out again. Have it a little bit. Perfect. Okay, don't let me push you in. Great job. And then back like this. Your elbow next to your body. Woo! I hit myself. Okay. Now don't let me turn you around, okay?
Okay.
Perfect. Hand down. Don't let me turn you. Perfect. Now wrist up. Okay. Wrist in. You're fine. Okay. And then go ahead and squeeze my fingers as hard as you can. Don't worry about hurting me. Perfect. Alright, so those were all 5s out of 5. Now I'm going to go ahead and do your left lower extremity. So I'm going to go ahead and have you have your hip up like this. Perfect. 1, 2, 3. Good. That was probably a 4+. Now I'm going to go ahead and have you, there you go. Don't let me pull you out. Okay. I'm just like moving all around. I want your leg a little bit, there you go, perfect. Don't let me push you in. Excellent. Don't let me push you in or out. You know what I'm saying. Mm-hmm. Don't let me push you in. Perfect. Go ahead ahead. Let's extend this just a little bit, and then go ahead and flex your foot up. Don't let me push you down. Excellent. And then go ahead and put that big toe up for me inside your shoe. Don't let me push you down. Excellent. Those were all 5 out of 5. So now we're going to go ahead and do your right leg. See how the strength is after that surgery. Can you go ahead and lift this leg up, or is it a little heavy?
It's pretty painful.
Okay,
Try and do
we
that.
don't have to do that today. I'm going to go ahead and push you out. Excellent. Don't let me push you in. Perfect. Now I'm going to go ahead and have you put that foot up. Excellent. How's that knee doing with that?
It feels pretty good.
Good. Now go ahead and lift that big toe up. Don't let me push you down. Perfect. Okay, so now we're going to do a little bit of more goatee work for you. You might get a little more better measurements while you're sitting here. So I'm going to go ahead and have you flex your leg a little bit as much as you can. And that lateral malleolus. Okay, looks like you're at 32 degrees of flexion. So I'm going to go ahead and push you a little bit, help you a little
that
bit.
hurts just a little.
Okay, try to do this as quick as possible. It looks like I got you to 38 degrees of flexion. So now I'm going to go ahead and have you straighten your leg as much as you can. That looks great. I think you're getting a little more extension here. Looks like you're lacking 21 degrees from neutral, and now I'm going to go ahead and help you just a little bit. Is that okay?
Yeah, that's it.
All right. We got to 16, so lacking 16 degrees from neutral.
All right.
Okay, so that looks like it's it for up here. So we're going to go ahead and transfer you into the wheelchair and then bring you down to physical therapy. Is that okay?
Yep, I'm ready.
Okay, wonderful. I'm going to go ahead and put the wheelchair here. Putting the brakes on. All right, so once again, this is touch weight bearing, so I don't want you to put any pressure on your foot. So I want you to lift up with your arms, put all the weight in this left foot, and then go ahead and reach back to this, and we'll get you going.
Okay.
Let me know if you need any help with that leg, okay? So I'll be right here.
Double time.
Ready? 1,
Yep.
2, 3, go. There you go. Perfect. We'll go ahead and like that, and then we'll do this side. And then that would be elevated, of course. Go ahead and bring this down for you. And then I'm going to drape you because it's a little chilly out in the hallways and down in the room.
Thank you.
Okay, and we're keeping your gait belt on because we're going down to PT. All right?
Sounds good. Thank you.
Okay.